Welcome back to Living Local. Joining us today, we have Dr. Marcy Tabor. We're here at Partners in Primary Care, Remount Road location. Thanks for having us today.
Thank you, Ashley. Good to be here.
Tell the folks at home, which I don't know how you don't know this yet because we've done a ton of stuff on Partners in Primary Care, but if you haven't seen those other ones, what is Partners in Primary Care?
Partners in Primary Care is a senior-focused primary care office in North Charleston, and we also have an office in West Ashley.
Okay, and
also.
what do? You focus on seniors, right? It's all about the seniors. Ages, what?
That's right.
When is it usually?
It's all about the seniors. If you have a Medicare plan, which is typically 65 and older, then
you're the place to go, right?
We are the place for you to come. Absolutely, we want to see you.
And you have like a robust team when it comes to how you approach a senior because they have different needs than, let's say, someone like me, right?
Absolutely. We do use a multifocal team approach. We have an RN level care coach to help manage our chronic diseases. We have a behavioral health specialist. We have access to pharmacy, social worker, and we all work together as a team.
We should always be looking at healthy options. How do you help them? Because I mean, that's like something you're not going to go to your normal doctor and get that type of treatment, right?
Absolutely. There's a number of different ways you can approach that. One is that you can focus on the preventative services that are available through the Medicare plans and make sure that patients get their preventative services too. They help to identify disease processes at an early stage when there's more likely for a cure.
Things?
Oh, they can be colonoscopies and mammograms and bone densities, blood screens for certain types of diseases. So there's a number of different ones, and they are important. They can also be immunizations too, for influenza and the pneumococcal vaccines.
Is shingles one of them?
And yes, absolutely.
And
the shingles vaccine.
Don't let the blonde hair fool you, right?
Absolutely. So that, yes, those are all very important items to talk about that can get overlooked if you're only going in if you're having a problem that needs addressed.
Mental health. Think about that aspect, right?
Absolutely. Mental health is very important. We do an assessment every time a patient comes in, evaluate them for their mental health. We have access to a mental health specialist who can call you up, talk to you, get you to an appropriate referral service if you need that, someone that I work very, very closely with. So whatever you need, we can help you with.
So it might not just be eating, it might be experiencing things like loneliness and
absolutely.
And
isolation
anxiety.
Is a huge problem in the COVID era.
So what are the things that if I'm at home and I want to know how I come here? You know, a lot of times you think you need referrals to everything and things like that. And you can also help us figure out if our plan works here, right?
Absolutely. The easiest thing I can tell you is to call us. We have trained staff here that will help answer that question. What would be a good fit for you? We can arrange for you to have a VIP guided tour, meet the staff, see the facilities, see if this will work out for you. We have an easy location, plenty of parking, one in West Ashley.
It is plenty of parking. That's an important thing these days.
Yes.
Alrighty, well, thank you so much for having us again.
Thank you.
And for more information, head online to seniorfocuscare.com.